Hello dear colleagues and viewers, I'm Dr. Rashid Ganji, an orthopedic surgeon. Within recent 10 years of my 25-year career, I have performed just total knee replacement. In nearly 1,000 knee replacement in my practice during last year in a private hospital, periprosthetic joint infection with its disastrous implication constantly posed a considerable challenge to our team, though being preventable and manageable. The number of surgical site infections following joint replacement continues to rise, threatening the ultimate success of the procedures and causing morbidity and hence a critical socioeconomic burden. Practicing orthopedic surgeons have made great effort to minimize this issue. Although high-level evidence may support some of these practices, many are based on little or no scientific foundation. This results in a wide variation in strategies taken by surgeons across the globe for prevention and management of PGI. To address this, the International Consensus Meeting on Periprosthetic Joint Infection was organized in 2013. As you may agree with me, before that, many principles and strategies regarding prevention, diagnosis, and treatment of PGI had remained unchanged for more than 50 years, causing considerable confusion in prosthesis infection management for orthopedic surgeons. The second meeting on musculoskeletal infection in 2018 built on success of the first ICM meeting and implemented additional steps based on the input of the delegate from the prior meeting with the intention of improving the outcome. The spectacular efforts put into this consensus made it a major breakthrough in the field, and this inspired me to review and highlighted the main features covered in this gathering, make further comparison if needed, and finally include more recent studies to make it more usable and accessible for my colleagues and scholars. First of all, I'd like to thank my friend Professor Parvizi and also my mentor Professor Gurki. I've had the honor of being with these iconic figures of the field several times in their centers as well as different congresses.
As you know, the consensus meeting was held in Philadelphia this July. The mission is to bring together expert doctors and scientists from around the world to determine the state of the art and thinking related to orthopedic infections. 890 delegates were involved in this process, 653 were in presence, 98 countries were represented, and it went through a very long and drawn-out process over 2 years, following the Delphi method, which spanned over the preceding prior to meeting in the Philadelphia meeting. And this time we've covered all the specialties with the exception of hand. Last time it was only hip and knee. It's been published already in Journal of Arthroplasty thanks to Dr. Callahan, OREF, and AHX support, and it's available free to download for you if you wish. And it's obviously, you've seen the book, again, thanks to Seth for distributing the book in this meeting. It's getting translated to a few languages at the moment. And the document is available electronically if you don't feel like shipping around the book. It's available on ICM Philly, both Android and iOS. You can download, and it's got a few.
At this moment, I'd like to appreciate the phenomenal scientific work performed by the Journal of Arthroplasty. The authors, whose name and pictures you can see, have made considerable contribution to the meticulous review of the article analyzed in the second consensus. The consensus is divided in two main sections, namely General Assembly and Hip and Knee. In each section, there are several divisions, mainly in prevention, diagnosis and treatment, and some other controversial issues. At this moment, we are going to focus on a significant part of hip and knee section, which is treatment. Treatment of hip and knee is in turn divided into 11 subdivisions. The items covered in treatment subdivision include algorithm, DAIR, one-stage exchange, two-stage spacer, two-stage exchange, surgical technique, prosthesis factors, salvage, antimicrobials, antimicrobials two-stage, and finally antimicrobial suppression. First, we are going to discuss algorithm, which just covers some general principles, and we have 4 questions in this subdivision. The first question asks whether early postoperative infection and acute hematogenous infection